Welcome everybody. So my name is Naomi. I am the founder of Little Crown Interiors. So I'm a nursery and kids room designer, and I am a guest moderator today for Auggie. And our host today is Anna McMaster. Is that correct?
Yeah.
Yes. Um, so she is going to talk to us about pelvic floor therapy. So I'm going to go ahead and pass that off to you. And anyone, if you have questions during the presentation, feel free to add them to the chat and I'll ask them if it seems relevant. Otherwise, we'll do a Q&A at the end. So please pop them out as you think of them so you don't forget, and we'll get to the questions.
Awesome.
All right,
Thank you.
go for it.
All right. Well, yeah, my name is Anna. I am a pelvic floor and women's health physical therapist. And I'm also the founder of Amy, which is a digital women's health pelvic floor platform that is launching soon. I'll talk a little bit more about that at the end. But today, what we are getting into is how to prep for birth from a pelvic floor PT perspective. So let's get started. Right, so this is what we're going to be covering today. And I tried to make this presentation a little bit shorter so that we had time at the end to go over everyone's more personal questions, but just getting into the basics here. All right, so first of all, what is birth prep? What does that even mean? And the way I like to think about it or kind of frame this whole conversation is about what can we control when we're talking about like labor and birth and delivery versus what can we not control. Because there are a lot of things in birth that we can't control, or pregnancy in general, right? Like we can't control if our baby decides to be breech for their whole pregnancy, right? We can't control necessarily like how long it takes for the baby to labor down. What we can control is how we kind of prepare our body and minds ahead of time. And I I never like to say like, oh, if you do all XYZ, you'll push your baby out in two pushes. Like there's no guarantees like that I can offer you, unfortunately. But what I can say is if you do these things, that we are trying to just optimize your experience of labor and delivery and just make it that much a little bit easier for that baby to get on down and out of there. And so birth prep from a pelvic floor PT perspective typically includes some hip and pelvis opening stretches and movements, perineal massage, and then learning how to push. And we typically start all of this stuff around like 32, 34 weeks. But specifically like the hip and pelvis opening stuff you could be doing for a lot longer, especially if you're having some hip pelvis back discomfort. But for the other stuff like perineal massage, there's nothing that you need to be like earlier is not necessarily better for some of those things. All right, let's get into it. Okay. So why are hip and pelvis opening exercises even important? So for a vaginal birth to occur, baby has to get from all the way up inside your abdomen, down into the pelvis, through the pelvis, and then out the bottom of the pelvis. And while we have this wonderful hormone called relaxin that is flooding your body through pregnancy, its whole point is to make the joints of the pelvis looser so that they can be more mobile to allow that process to happen. Even though we have that, the muscles surrounding the pelvis can still be tight and restrict some of that movement. So what we tend to want to work on is there's actually kind of three levels of the pelvis that we can open up or loosen a little bit more. And that is the top, the mid, and the lower pelvis. And so, like I kind of mentioned, at the beginning of labor, when the baby is still kind of higher up, we want to allow the top of the pelvis, the pelvic inlet, we call it, to be open so the baby can drop down into the bowl of the pelvis. And then, kind of later on in labor, we want the middle of the pelvis to be able to move and be flexible enough so that the baby can kind of, I don't know if you've taken like a birth prep class or maybe like the I forget that video we all watched in biology, but babies have to kind of like twist and turn their way like as they go through the pelvis. That's why it's important to have the mid pelvis be mobile so that they can kind of fully twist and descend at the same time through there. And then the lower pelvis, this is where the baby again makes their out exit. So that includes like the pelvic floor muscles. So we want all of those to be kind of open and relaxed as much as possible to allow for that movement to be as easy as possible. So in this next slide, I have, great, my kind of favorite top 5 hip and pelvis opening exercises that I give all my patients. There are hundreds upon hundreds of different like hip stretches that you can do. None of them are going to be like wrong or better than the others. But I like these because these 5, this like hits top, middle, bottom of the pelvis. So if you want to, or if you have these things, you can kind of follow along. If not, I will be sending this presentation out, so you'll have access to these. But first one, ball circles. So this is a nice one. It just feels really good, first of all. But what this is doing is it helps open the top of the pelvis. So this is for really good to do like um, in preparation for labor, but if you are actually in labor in the very early stages, can help that baby just like drop down in there. The second one, we have posterior pelvic tilts. You can see she's like really tucking her pelvis under. This also helps open up the top of the pelvis. If you can imagine when you are pregnant, right, your baby is kind of out in front of you. And when you tuck your pelvis under, you're kind of scooping that baby back in so that it's easier for them to drop down. This stretch is one of my faves. I do it like every day, but a kneeling adductor inner thigh stretch. So you're putting one leg out to the side and she's rocking quite a bit. You can rock back and forth that much. You can do it smaller. You don't have to rock at all, but those inner thigh muscles attach right to the front of your pelvis. And so if those are really tight, that can restrict kind of that movement there. All right, so puppy pose here. What I will say, so this is puppy pose with hip internal rotation. And all that means is you'll see her put her feet kind of wider than her knees are. And in that position, that really, really opens the bottom of your pelvis up. If you try this stretch, you'll might be like, whoa, I feel very exposed back there. Yes, that is the point. You also do not have to do it with the internal rotation. If you want to just do puppy pose with your feet kind of in line with your knees, that will also work. This is just kind of the more, not extreme, but a little bit more extreme version. So she's here. And yes, again, you will feel that bottom of the pelvis open up in that position. And last one, pelvic floor lengthening. This one is a little bit challenging for people. So I'm gonna teach us how to do this really quick, actually. If you want to follow along, pelvic floor lengthening is like the opposite of a Kegel. So if we think about a Kegel as you are closing all the openings and lifting up, pelvic floor lengthening is letting the pelvic floor muscles kind of come down and out. And again, why this is important is for that last stage of labor, when you are pushing the baby out, the baby has to go kind of through your pelvic floor muscles, right? So if you are contracted or in a Kegel as the baby is trying to go out, baby is going to come out, but it's going to be a lot more difficult than if our pelvic floor knows how to kind of relax and bulge. So what I want you to do is, if you kind of make sure that you're sitting evenly on both your sit bones, really put your attention down to your pelvic floor, which is the area between those two sit bones. And think about, okay, your pelvic floor should just be kind of sitting on the surface that you're sitting on right now. If you do a Kegel, you should kind of feel it lift a little bit off the surface. And then when you relax, should come right back down to what I'm going to call the ground floor. So when you do a Kegel, we're like up at the first floor, come back to the ground floor. Now with lengthening, we're going to try to go down to the basement. And so what I want you to try to do is on your inhale, you're going to take a big inhale and imagine that that breath is inflating your pelvic floor so that it goes down to the basement. Your sit bones are like widening just a little bit. So on your inhale, we lengthen, exhale, comes back to the ground floor. And that's all this video is. We can kind of do it together. Inhale, lengthen, exhale, ground floor. Inhale, lengthen, exhale, ground floor. Inhale, lengthen, exhale, ground floor. Now, that one is, again, it's hard for people. So I encourage you to practice on your own first. But that one's a really nice one. I really like that one. Okay, let's move on.
A quick question.
Yes.
Um, so how often should people be doing that set of exercises? And then how many reps, how many sets, days of week, that kind of a thing?
Yes. So I would say this specific set, I would start doing again around that like 32, 34 week mark. And I mean, for ball circles and the posterior pelvic tilts, I'm not super like, oh, you have to do X many sets, reps, whatever. Like if you're someone who's sitting on the ball is just comfortable, like you can, if you're still working, sit while you're working or like watching TV and just kind of casually doing ball circles. Like you could do both of those for several minutes at a time. At minimum, I would probably do about 30 seconds of ball circles in each direction. And the posterior pelvic tilt's probably a minimum of like 20 total in a day. Again, not super formal, but just trying to get the body used to those kind of movements. And then the kneeling adductor stretch and the puppy pose, I would say again like 30 seconds on each side once a day. 30 seconds in that puppy pose, and then the pelvic floor lengthening. Again, probably about 20 a day if you can feel it. Um,
Yeah,
I
that one
would,
takes practice. I've worked on that
yeah.
one.
Yeah. So I would just like, if you can't feel it or do it yet, I would just focus on like trying to get the sensation there first, and not worry so much about like the numbers. But yeah, that one's a tricky one.
Okay. And then is there any alternatives specifically for those first two if somebody doesn't have access to the fitness ball?
The ball. Yes, so you can definitely do the posterior pelvic tilts just on like sitting on a couch or a chair. Um, that one, I actually I do it all the time, like in my desk chair to just help with my posture. And then if you don't have a ball, the ball circles, what I would do is just kind of do um, like a mix of general hip stretches. So like a figure four stretch, maybe 20, 30 seconds on each side. And then like a um, hip flexor stretch, like a kneeling um, to get the front of the pelvis a little bit. So that way it's a little more like formal, but the whole goal is just to really open up all the muscles around there.
Okay.
Cool. Alrighty. Good questions. Okay. So perineal massage, I put this in here just as a warning. There is going to be a picture of a perineum coming up. I didn't want to just jump scare people. Here we go. Okay. So perineal massage. First of all, what is a perineum? So a perineum is this area between the vaginal opening and anal opening, right in the middle. And this is the area that has the highest chance of tearing during a vaginal delivery. And so what perineal massage does, It has been shown to decrease the chances for higher grade tears, so third and fourth degree tears. And I put in here, not all tears. So again, I'm not promising that if you do this that you won't tear at all, but your chances are a lot better that you will not have a high grade tear if you do this. So this again, you start at 34 weeks, and there are a bunch of different ways that you can do it. You can do it yourself, you can have a partner help you, and there are actually now products like called pelvic wands that you can use if it's hard for you to reach. So I love this kind of infographic here from the Vagina Whisperer. So this is showing if you were to do it yourself. Now if you were to do it yourself, you are going to use your thumb because the angle is a lot better than if you tried to use your pointer finger. You'd have to do like a weird kind of to get that bottom area. Um, okay, hold on. I have instructions for us on the next slide, but what I want you to imagine is, or remember, is that the vaginal opening, think of it like a clock. We're focused on the areas between 9 and 3 o'clock. So we don't really have to worry about this top part. In fact, if you stretch up there, your urethra is up there and it's like not super comfy. So we want to just focus on this bottom half. All right. So we are going to practice, but on our hands. So if we imagine this is the vaginal opening. Oh, I should say this. Before you do this on yourself or have your partner do it, you make sure that you wash your hands and you make sure that you have short enough nails that you're not going to uh, cut yourself. Um, if you have like longer nails, I would definitely recommend either your partner do it or you use a wand because it's just not going to be super comfy. And you can also use a little bit of lube or like coconut oil or I think sweet almond oil or vitamin E oil are popular too, just something so that it's not, again, uncomfortable. So what you will do is you will insert your thumb into the vaginal canal just until your first knuckle. So the perineum is just that very superficial part. We don't have to go super deep in there. And you're going to find that 6 o'clock spot. And you're going to press down very gently at first. And then you're kind of pressing and you're finding like, okay, this is the spot where I feel like it's definitely stretching. It might feel a little burny, might feel a little bit intense, but it's not like 10 out of 10 pain, right? We're aiming for the very solid stretch, but not intense pain. So we hold for like 20 or 30 seconds, and then we release and we do that same thing again, kind of all along that 3 to 9 U shape. Um, if you're going to do this yourself, I recommend people do it right before they get into the shower. And I have a picture of this, I think, in the next slide. But if you put your foot up on the toilet or on like your bathtub, it makes it a little easier to kind of reach down in there. If you're going to do that yourself before you get in the shower every day, you can do it for a less amount of time. So I always say like about 2 minutes every day if you're going to do it yourself. If you are going to have a partner help you or use a wand, those things are not as like easy logistically to do. So I would recommend doing it maybe like 2 or 3 times a week for a longer time period, right? So like if you do it 2 times a week, maybe you're doing it for like 5 to 7 minutes at a time. 3 times a week, maybe like 3 to 5 minutes at a time. In the research, there's not one like specific protocol. But what you are aiming for is by the time you get to, 38 to 40 weeks, that you are really able to like stretch pretty intensely in all of those directions without a lot of discomfort. Um, okay, and then the last point on here, try a sweeping massage. So not everyone gets to this point, but if pressing down pretty firmly is like not a problem for you at a certain point, you can also try a sweeping massage, which is moving that thumb kind of back and forth. Um, that's not super necessary, but some people are able to get to that point and some aren't. So with a partner, again, make sure they wash their hands, trim their nails. They're going to do the same thing, but they're going to use their pointer finger. So they're inserting to their first knuckle. And this is where communication between you two is super important, because especially if you have a male partner, I have taught many of male partners in the clinic, and I always say, press, like, don't press, like, press as soft as you possibly can. They're like, yeah, yeah, yeah. And then they always go in and they just like jam on your perineum. So really try to tell them like the softest touch at first, and then you can gently and tell them like constant communication of like if it's too much or if they can go a little more or whatever. Um, but yeah, they'll do the same thing. They'll press and hold for 20, 30 seconds and then move to the other spot and so on and so forth. Okay. And then here's where I have. So this is kind of that position I was talking about. If you're doing the perineal massage yourself, put one leg up on the toilet or bathtub somewhere that you can hang on for good balance. And in her case, her left leg is up, so you'll use your right thumb to kind of reach down. Again, these are the kind of the options here. This is Intimate Rose pelvic wand, and this is the Freedom Mom. This is like specifically, I think, for the perineal massage. Um, both do the same thing. You could even, if you really want to, you could use like a vibrator or something. Doesn't really matter. Just something to help you with that reach to get down there. If you can't, like some of us don't have the arm to torso ratio where you can reach, especially around a third trimester belly. So that is perineal massage. I guess I'll stop here really quick if anyone, are there any questions about this one, about this yet?
Not yet on this,
Okay,
unless
cool.
anyone
So
wants to chime in the chat. I'll let you know if anything pops in there.
cool. And that's okay. We can go over it later too. All right. How to push. Cool. So um, there are kind of two main forms of pushing, with exhale or with breath and holding our breath. So on social media, in the literature, anywhere, you're going to find different terms for all of these. There's like purple pushing, there's breathing your baby out, there's all these different terms. They all mean kind of the same thing. Um, and so when I say with breath or with an exhale, that means that you are pushing and breath or sound, something is coming out of your mouth. Holding breath means when you are pushing, nothing is coming out of your mouth, right? So let's talk about the research behind this. I mentioned social media because there's a lot of stuff. A lot of people have a lot of opinions on how you're pushing, etc. What I will say in the research, most recent that has come out, is I'm laughing because, of course, we can't really say that there is one type of pushing that is the best for everyone, which makes sense. Goes back to my first point that I was saying, that there is a lot about labor and delivery that we cannot control. And every person's birth is different, even from like pregnancy and birth to birth, they're different. And so we cannot say that like 100% everyone needs to do this specific way. We just can't. So what the research says is that the best type of pushing for you is what works for you, which it might be frustrating, but I actually love that because that gives us kind of a variety, a choice. And so with that research, what I always have all my patients do is we practice both types of pushing, because in the event that one type is not working for you in the moment, that's fine. We go to the other type. So Again, I will have us practice here if anyone wants to, but this is where that kind of pelvic floor lengthening comes in. So when we practice pushing, again, we're not, when you go to deliver, you're like pushing 10 out of 10, right? Like that's the most intense pushing you will ever do in your life. When we practice, we're doing like a 3 out of 10, right? We're just like getting our body used to that movement. But what you should feel when you practice pushing is that that pelvic floor is dropping down. If you are pushing and you feel like your pelvic floor is coming up or you're doing a Kegel, then that tells me that we need to practice that because that's what we don't want to happen when you're actually pushing. So let's practice with an exhale first. So what I will have you do is we're going to take a really big deep inhale. And then on that exhale, think about really those sit bones really pushing apart, that pelvic floor really dropping down. So it looks a little bit like this. And again, on that exhale, you should feel that pelvic floor dropping down. Um, I also want to make a note that with breath or with exhale can also mean like with a sound, right? Like you can make a sort of like a grunting sound or some sort of sound. It just basically means that something is coming like through your vocal cords. Um, so that is with breath. With holding breath, you're going to do similar, but you're going to inhale and then you are going to hold your breath and bear down and outward. So it looks like this. Push and then relax. Push and then relax. Okay. And you can kind of try for yourself. I like to have patients try in a bunch of different positions too. Like if you know you're going to have an epidural, try it in that similar positions, right? Like kind of propped up on your back with your legs up or on your side. Just trying to get that muscle memory for that when that happens. Or if you are planning to go unmedicated and you would really like to deliver, say, on hands and knees or in a squatting position, that you practice both types of pushing in all the possible positions that you could possibly be in when that happens. And just take note of like, okay, does one feel a lot easier for me? Does one feel a lot better? If you are someone who's like, I really feel a lot better when I uh, exhale when I push. Amazing. I would make sure that you put that in your birth preferences and tell that to your doctor, tell that to your partner, your doula, whoever's going to be there, so that everyone is on board when the time comes. Just because if you go into the hospital and don't tell anyone that you want to try and exhale with your breath, they will cue you to just hold your breath just because that's just what they do. Um, so that I think brings me to the end of my formal presentation. Yep. So bottom line is that birth prep helps us optimize the parts of birth that we can control. Typically start all of this stuff at around 34 weeks. Perineal massage helps us prevent higher grade tears, so third and fourth degree tears. Push how it feels good for you to push. And no matter what happens during your delivery, you know that you did everything you could and your family will still have grown.
Awesome. Thanks, Anna.
Yeah,
Um,
I'm gonna
so
stop
a couple
sharing
quick,
this.
oh, yeah,
There we go.
couple quick things. You let me take you off the spotlight. There we go. So as we know, birth plans don't always go the way that I think they're going to go. So if somebody, for example, ends up doing all of this practice and all of these exercises, and then they end up needing a C-section or something different, um, is there still a benefit?
Absolutely. Um, like I mentioned, the hip and pelvis opening stuff, while it is, officially for birth prep, your hips and pelvis and all of those muscles around there just can get very tense and tight during pregnancy anyways, especially as the baby gets bigger, your center of gravity is changing. And so I, you know, even if someone isn't coming to me specifically for birth prep, I oftentimes give those exercise or stretches anyways, because there's usually like, oh, my hip hurts when I'm sleeping, or like my back is hurting me. And all of those exercises are great for just general the aches and pains that come with that anyways. As for the other stuff, perineal massage, and kind of learning, it's more about like the awareness of your pelvic floor and to like be able to control it, right? Like getting that coordination down of like the lengthening and all of that stuff. Um, so all of those skills are really helpful just in life anyways. Um, you want to be able to relax your pelvic floor when you want it to relax. And yeah, even though your perineum was prepared for a baby to go through, the in the end, like it's still good to kind of make those connections and kind of work through that.
Okay. And I imagine too that like any anything you're doing to improve your, muscle memory and your coordination and all of that is going to benefit you in the post birth part as well, right? Like getting your muscles kind of back into shape and kind of keeping you, maybe healing would be a little bit easier. Is that the case?
Yeah, exactly.
Mm-hmm.
It's totally, like about that muscle memory and about
Mm-hmm.
the kind of proactive training of your muscles, right? Like if you it's kind of that saying, even though I don't love it, but it's like if you don't use it, you lose it, right? So,
Right.
and in that first 6 weeks postpartum, whether you had a cesarean or vaginal delivery, like your muscles are just like shot. And so if they have that memory from beforehand of like, okay, no, I know how to contract my core, I know how to coordinate my pelvic floor, like all of that's going to come back easier um,
Mm-hmm.
than if you didn't practice that beforehand.
Okay. Um, and so I've seen a lot of different influencers uh, and such talking about this type of, specifically the perineal massage, where some people are saying to start much earlier. Um,
Interesting.
and, there's lots of different practices. Is there any harm in either starting earlier or doing it too much or not enough, or what, because there's so much information out there. If somebody's reading something, how strict are the guidelines?
Yeah. I mean, I like I mentioned, there's not a one consensus in the research, and there's just like not a ton of research, right? I would say the only time where I have had someone start that much earlier in their pregnancy is when they've had a known history of like chronic pelvic pain or like pain with intercourse. So someone
Okay.
with like vaginismus, or if you already know that your pelvic floor is like really, really tight, um, that's that's something where yes, let's start working on that earlier because it's going to take us longer to get to the point. Um, I would say, it takes the average person about that like 4 to 6 weeks to get, if you do it consistently, to get to that point um, where you can like really push down. So it's like, if you start earlier and you like kind of get done earlier, you should still keep practicing. So for
Okay.
me, I come to it from like, do you have time to do all of this stuff? Like, there's just a lot that we're all doing. And so if you're like 28 weeks and you're like super busy and you already have like a toddler at home and blah, 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 I'm going to be like, don't don't waste your time. Like, just do it later when you're going to get like kind of the most bang for your buck. You know what I mean?
Okay. Someone in the chat just said my OBGYN did the massage while she was pushing.
Yes.
Is
So
that
there
common as well?
is. Yes. So there's I'm gonna forget the official wording, but what I'm talking about is like uh, prenatal perineal massage. But it is very common practice to do perineal massage like as the baby is kind of crowning, and so they'll often kind of do it with
Hmm.
both hands like this. So that's kind of the idea behind doing it ahead of time is you get those perineal tissues ready so that
Hmm.
when the doctor is just like, let's help this along too. And so if your perineum is already like, oh yeah, like I totally know like what this feels like, I'm stretchy, I'm good, then even more helpful. But yes, they will oftentimes
Okay,
do perineal massage and or put like a warm compress on the area to help with that.
awesome. Does anybody have any last questions before we wrap up here? Thank you so much, Anna. It was great.
Yeah, I always feel like I talk so fast because all this stuff that I want to tell people. So
I know there's so
um
much to it. Um, but yeah, Anna is going to send out a copy of this presentation, so you'll have access to that. And there'll be a follow-up from Augie. So if there's no other questions, we'll go ahead and wrap up. So thank you so much, everybody, for attending, and keep an eye on more events and stuff in the Augie community, and have a wonderful day.
yeah, thank you so much, everyone.
Bye. Oh,
Hold
are
on,
you
there's
still
one more
there?
question here.
One more
Yeah.
question. Yeah. Let's see. I have pelvic symphysis. I don't know if I'm saying that right.
Mhm.
I did not have it the first time. I'm wondering if this means if I have pelvic floor and or if it means I'm more likely to have issues postpartum.
So pubic symphysis dysfunction, you have like that really sharp pain in the front of your pelvis, I'm assuming. Um, it's pretty common, especially second time around. It doesn't necessarily mean that you have like pelvic floor dysfunction. Yeah, exactly. But they can be correlated because if you have pain in your pelvis, the pelvic floor muscles are so close to there that sometimes they can like um, the way that pelvic floor muscles react to pain is typically by tightening. So I would, if you have access to a pelvic floor PT anywhere, even virtually, get at least an assessment and try to figure out if you are tense, right? Then, oh, I hate that. I hate that so much. That
Yeah. So
is
she said she has a referral, but
three
I
to
don't know
four
if
months
anyone else,
out.
everyone could see. Yeah, 3 to 4 months out for a referral.
Yeah.
Yes, this is always the problem.
Um, ugh, okay. I'm like, I have so many thoughts. I'm not gonna get on my soapbox, but
Exactly.
so yes, I would say if you can't, like if you tried to do that lengthening and you're like, it's not happening, then that probably tells you that your pelvic floor is a little bit tense. So I would say that's probably what you would need to work on. Otherwise, um, cubic symphysis typically goes away like right when you deliver because it's a lot about just the baby is just sitting right on that joint, making it difficult for it to function properly. But it doesn't necessarily mean that you're going to have issues afterwards. I will say, I'll say one thing about my company. So this was one of the big reasons why I created my company, Amy, is because there just aren't enough pelvic floor PTs and there aren't enough, well, there's not enough pelvic floor PTs and a lot of them are out of network. So anyways, I'll send you more information in my email, but this is one of the reasons why I created it because the access is just like it's not there for everyone. So should I do those exercises through the pain and doesn't? With pubic symphysis dysfunction specifically, I don't recommend pushing through the pain. So I would try specifically like that big adductor stretch where her leg was out. That's probably not going to feel great for you. Um, because that's like putting pressure on that joint. So I would try to stay with things that are within your pain-free range of motion.
Okay, so keep doing some exercises, but just stop before they get to that pain threshold.
Exactly. Like, so the
Yeah.
range of motion, and especially in those videos, like I had her do like very dramatic range of motion so you could see.
Hmm.
But if you end up doing like, much smaller pelvic tilts or much smaller ball circles, like that's still gonna get the job done. Um, but you just do with what your body is, how your body's feeling that day. Yeah, you're welcome.
Okay.
All right.
Okay. And with that, we will wrap up once again. Thank you again, everyone. And look out for that email and have a great day. And thanks again, Anna.
Thank you, everyone. Have a good Friday.